What is myofascial pain syndrome, MPS? Myofascial pain syndrome is a chronic pain disorder characterized by pressure on sensitive points in your muscles called trigger points, which can cause pain in the muscle itself and in seemingly unrelated parts of your body. This is known as referred pain. Think of a trigger point as a small, hyper-irritable knot or tight band within a muscle. When you press on this knot, it not only hurts at that spot, but can also send a jolt of pain to another area. Key concepts. Fascia. This is the thin, strong connective tissue that wraps around and supports every muscle, bone, organ, and nerve in your body. In MPS, both the muscle and the fascia can become tight and restricted. Trigger points. These are the hallmark of MPS. Active trigger points. These are knots that are actively causing pain, either at rest or with movement. They're tender to the touch and produce the characteristic referred pain pattern. Latent trigger points. These are knots that don't cause spontaneous pain, but can restrict movement or cause muscle weakness. They only become painful when you press on them. Example of referred pain. A trigger point in the upper trapezius muscle, the large muscle between your neck and shoulder, can cause pain that feels like a tension headache wrapping around the side of your head and behind your eye. The problem is in your shoulder, but you feel it in your head. Symptoms of myofascial pain. The primary symptom is persistent, deep, aching muscle pain. Other common symptoms include tender knots in a muscle that you can often feel, pain that worsens when the affected muscle is stretched or strained, reduced range of motion in the affected area, for example, difficulty turning your head fully, muscle stiffness, weakness, or fatigue. Associated symptoms like tension headaches, sleep disturbances, jaw pain, TMJ, and ringing in the ears, tinnitus. Myofascial pain versus fibromyalgia. These two conditions are often confused, but they are distinct. Feature: myofascial pain syndrome, MPS, fibromyalgia. Pain location: regional or localized to specific muscles caused by trigger points. Widespread and diffuse pain across the body involves tender points. Nature of pain: deep, aching muscle pain with specific referred pain patterns. General aching, burning, or throbbing pain, often accompanied by severe fatigue. Key feature: palpable knots, trigger points, that cause a twitch response when pressed. Widespread tenderness without palpable knots. Pain is more systemic. It is possible to have both conditions at the same time. Causes and risk factors. MPS is often caused by a muscle being contracted repeatedly or being put under sustained stress. Common causes include muscle injury, an acute injury from sports or an accident, repetitive motion and overuse, jobs or hobbies that involve repetitive movements like typing, using a mouse, factory work, playing an instrument. Poor posture. Sitting at a desk all day with hunched shoulders or forward head posture puts chronic strain on neck and back muscles. Stress and anxiety. Psychological stress can lead to chronic muscle clenching and tension. Lack of activity. Sedentary lifestyles can lead to deconditioned and weakened muscles that are more prone to developing trigger points. Nutritional deficiencies. Lack of certain vitamins like D and B complex can contribute to muscle pain. Diagnosis. There is no single lab test or imaging study like an X-ray or MRI that can diagnose MPS. A diagnosis is typically made through physical examination. A doctor or physical therapist will palpate or feel your muscles for taut bands and tender trigger points. They will look for local twitch response, a visible or palpable contraction of the muscle when the trigger point is pressed. Referred pain, asking you where you feel the pain when they press on the knot. Patient history, discussing your pain patterns, activities, job, and any recent injuries. Range of motion assessment, checking for stiffness and limitations in movement. Treatment and management. Treatment for MPS focuses on releasing the trigger points and addressing the underlying causes. A multifaceted approach is usually most effective. Professional therapies. Physical therapy is the cornerstone of treatment. A physical therapist can teach you specific stretches and strengthening exercises to correct posture, improve flexibility, and prevent recurrence. Myofascial release, or massage therapy. This is a hands-on technique where a therapist applies gentle, sustained pressure to release tightness in the fascia and muscle. Dry needling. A trained professional inserts a thin, solid, dry needle, no medication, directly into the trigger point. This elicits a twitch response, which helps release the knot, reduce pain, and restore function. Trigger point injections. A doctor injects a substance, often a local anesthetic like lidocaine or saline, into the trigger point to deactivate it and provide pain relief. Osteopathic manipulative treatment, or OMT, or chiropractic care. These practitioners use various hands-on techniques to restore mobility and function. At-home and self-care strategies. Heat therapy. Applying a heating pad or taking a warm bath can help relax tense muscles. Stretching. Gentle, regular stretching of the affected muscles is crucial. Self-massage. Using tools like a foam roller, lacrosse ball, or Theracane allows you to apply pressure to your own trigger points. Postural awareness. Be mindful of your posture when sitting, standing, and working. Take frequent breaks to stand up and stretch. Stress management. Techniques like meditation, deep breathing, and yoga can reduce the muscle tension caused by stress. Exercise. Regular, gentle exercise like walking, swimming, or yoga can improve overall muscle health. Medications. Medications are often used for symptom management rather than as a cure. Pain relievers. Over-the-counter NSAIDs like ibuprofen and naproxen can help with mild to moderate pain. Muscle relaxants may be prescribed for short-term use to help with severe muscle spasms, especially if they interfere with sleep. Antidepressants, some types like amitriptyline, are prescribed in low doses to help reduce pain and improve sleep. When to see a doctor. You should consult a healthcare professional if the pain is severe, persistent, or getting worse. It significantly interferes with your daily activities or sleep. Self-care measures are not providing relief after a week or two. Disclaimer. This information is for educational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider for a diagnosis and treatment plan.